Hey everyone, it's Dr. Pimple Popper here, but today we're diving into something a little different, the NCLEX-RN. Now, I know what you're thinking. What does popping pimples have to do with passing this exam? Well, just like any good extraction, acing the NCLEX requires focus, precision, and a whole lot of knowledge. Preparing for the NCLEX-RN can be daunting, kind of like facing down a giant dilated pore of doom. But focusing on the key topics can help streamline your study process. We're going to break down these crucial concepts into bite-sized pieces, making them easier to digest. And trust me, you'll thank me later when you're holding that shiny new RN license. In this video, we'll cover the most important topics you need to focus on, from management of care to physiological adaptation. Think of this as your roadmap to NCLEX success, guiding you through the must-know information. And don't worry, we'll also sprinkle in some essential study tips along the way to keep you on track and motivated. So buckle up, grab your stethoscopes and your thinking caps, and let's get this NCLEX party started. Remember, you've got this. All right, future nurses, let's kick things off with management of care, a cornerstone of nursing practice. This is all about providing safe, effective, and patient-centered care, which, as you'll soon learn, is the name of the game in nursing. First up, we have advanced directives, legal documents that outline a patient's wishes for medical care if they become unable to communicate them. Think of it like a roadmap for their healthcare journey, guiding us on how to best respect their autonomy and make decisions that align with their values. Next, we need to be well-versed in client rights. These are the legal and ethical guarantees every patient has when receiving healthcare, such as the right to informed consent, privacy, and confidentiality. Remember, treating patients with dignity and respect is just as important as any medical intervention. And speaking of ethical practice, it's crucial to understand the ethical principles that guide our nursing practice. Beneficence, non-maleficence, justice, autonomy, these are not just fancy words. They are the very foundation of ethical decision-making in healthcare. We'll delve deeper into these principles and how they apply to real-life scenarios you might encounter. Now let's talk about something near and dear to my heart, safety. Safety is the cornerstone of effective healthcare. Without it, the entire system would crumble. It's not just about following rules, it's about creating a culture where everyone feels responsible for the well-being of others. Just like in the world of dermatology, where we prioritize sterile techniques to prevent infections, safety is paramount in nursing. Every action we take, every decision we make, is guided by the principle of do no harm. This means being meticulous in our practices and always staying informed about the latest safety protocols. Safety is paramount in nursing. It's not just a set of guidelines, it's a mindset. From the moment we step into a healthcare facility, we are responsible for maintaining a safe environment. This involves everything from proper hand hygiene to the correct use of medical equipment. It's all about creating a safe environment for our patients, ourselves, and our colleagues. This means being proactive rather than reactive. We must constantly assess our surroundings and identify potential hazards before they become real problems. First and foremost, we need to be vigilant about accident and error prevention. This involves a keen eye for detail and a commitment to continuous learning. The healthcare environment is dynamic and new challenges arise every day. Staying updated with the latest safety protocols is crucial. This involves being aware of potential hazards in the healthcare setting, following established protocols, and using critical thinking skills to anticipate and prevent errors. It's about being one step ahead and always prepared for the unexpected. Using critical thinking skills to anticipate and prevent errors is a vital part of our job. We must be able to think on our feet and make quick, informed decisions. This is where our training and experience come into play. We must trust our instincts and rely on our knowledge to guide us. Remember, even small oversights can have big consequences. A minor mistake can lead to significant complications for a patient. This is why attention to detail is so important. Every step we take, no matter how small, must be done with care and precision. Speaking of consequences, let's talk about handling hazardous and infectious materials. This is a critical aspect of our job. We are often exposed to substances that can be harmful if not handled correctly. Proper training and adherence to safety protocols are essential. From bodily fluids to sharp instruments, nurses encounter potentially dangerous substances daily. We must be vigilant and follow proper procedures to ensure our safety and the safety of our patients. This includes the correct disposal of sharps and other hazardous materials. We need to be well-versed in proper handling techniques. This includes understanding the risks associated with different substances and knowing how to mitigate those risks. Training and education are key components of this process, including using personal protective equipment, PPE, like gloves, gowns, and masks, to protect ourselves and prevent the spread of infection. PPE is our first line of defense against hazardous materials. It's essential that we use it correctly and consistently to protect ourselves and prevent the spread of infection. Proper use of PPE is not just about protecting ourselves, it's also about protecting our patients. By preventing the spread of infection, we are ensuring a safer environment for everyone. And while we're on the topic of infection, let's discuss standard precautions. These are the basic infection control practices that we use with every patient, regardless of their diagnosis or infection status. They are the foundation of our infection control efforts. This is our bread and butter, folks. Standard precautions include hand hygiene, the use of PPE, and the proper handling of potentially infectious materials. These practices are essential for preventing the spread of infection in healthcare settings. It's the basic level of infection control we practice with every patient, regardless of their diagnosis or infection status. Hand hygiene, anyone? Hand hygiene is the single most effective way to prevent the spread of germs. It's a simple yet powerful tool in our infection control arsenal. It's the single most effective way to prevent the spread of germs. Proper hand washing techniques are crucial. We must ensure that we wash our hands thoroughly and frequently, especially before and after patient contact. This simple practice can make a significant difference in preventing the spread of infection. Hey everyone, let's talk about aging, something we're all going through, right? Just like our skin changes over time, so do our body's internal workings. As nurses, it's crucial to understand these changes so we can provide the best care for our aging population. Think about it like this. Remember those blackheads that seem to pop up more as we age? Our bodies are kind of like that. Things slow down, production changes, and we need to adjust our care accordingly. We'll delve into the specifics, but always remember that aging is a natural process, and our goal is to help our patients age gracefully and healthily. We're not talking about reversing the clock here, more like understanding how to keep those gears turning smoothly. Let's face it, folks, not all skin conditions are visible on the surface. Sometimes the most painful experiences are hidden beneath the surface, just like emotional distress. As nurses, we need to be vigilant in recognizing the signs of abuse and neglect, which can manifest in both physical and emotional ways. It's like noticing those subtle changes in a mole, a slight color variation, or an irregular border. These subtle cues can indicate something more serious is going on. Similarly, changes in behavior, unexplained injuries, or withdrawal can be red flags for abuse or neglect. We'll discuss the various forms of abuse, how to identify potential victims, and the steps to take if you suspect someone is in danger. Remember, our role is to advocate for our patients and ensure their safety and well-being, both physically and emotionally. All right, everyone, let's talk about assistive devices, those amazing tools that help our patients maintain their independence and mobility. Think of it like this. Just like a good extraction tool helps me get to those deep-rooted blackheads, assistive devices give our patients the support they need to navigate daily life. Whether it's a cane for stability, a walker for balance, or a wheelchair for mobility, these devices can make a world of difference for our patients. They're like superheroes, empowering individuals to participate in activities they love and live life to the fullest. We'll cover the different types of assistive devices, how to properly fit and use them, and how to educate our patients on their benefits. Remember, our goal is to help our patients achieve their highest level of independence and mobility, empowering them to live their best lives. Hey, future nurses! Dr. Pimple Popper here? Well, not really, but you get the idea. Let's break down this whole pharmacological and parenteral therapies thing. It's a mouthful, I know. Think of it like this. It's all about understanding medications and how they're given. First up, we've got the meds themselves. You'll need to know their uses, how they work in the body, and what makes them tick. It's like figuring out the ingredients in my favorite skincare products. You gotta know what you're working with. And just like those skincare products, medications can have side effects. Sometimes they mix poorly with other things, like certain foods or even other meds. It's like mixing retinol and AHAs. Not a good idea. That's why knowing about contraindications and interactions is super important. It's all about keeping your patients safe, and that's our #1 priority. We'll dive deeper into all of this in the next section. Hey everyone, it's Dr. Pimple Popper here, but today we're diving into a different kind of diagnosis. We're talking about those crucial diagnostic tests you'll need to know for the NCLEX-RN. Think of it like investigating a skin concern. You need to gather information to determine the best course of action, right? Diagnostic tests are like our magnifying glass, giving us a closer look at what's happening inside the body. You'll need to understand the purpose of various tests like blood tests, biopsies, imaging scans, and more. It's not just about knowing what each test does, but also when it's appropriate to use them. Just like I rely on different tools for different skin conditions, nurses need to understand which diagnostic test is best suited for each situation. For example, a blood test can reveal infection markers, while a biopsy helps us examine tissue for abnormalities. Remember, studying for the NCLEX-RN isn't just about memorization, it's about understanding the why behind each concept. So, as you study these diagnostic tests, think critically about their purpose and how they contribute to patient care. It'll make a world of difference on your exam and in your nursing career. Let's delve deeper into some of these tests. Take imaging scans, for instance. X-rays, MRIs, and CT scans each have their unique roles. X-rays are great for looking at bones and detecting fractures, while MRIs provide detailed images of soft tissues, making them invaluable for diagnosing conditions like torn ligaments or brain tumors. CT scans, on the other hand, combine X-ray images taken from different angles to create cross-sectional views of the body, which can help identify complex issues like internal bleeding or tumors. Understanding these differences is crucial because it helps you choose the right test based on the patient's symptoms and medical history. Ultrasounds are another essential diagnostic tool, especially in obstetrics. They use sound waves to create images of the inside of the body, which is particularly useful for monitoring the development of a fetus during pregnancy. Blood tests, as mentioned earlier, are incredibly versatile. They can check for a wide range of conditions, from infections and anemia to diabetes and cholesterol levels. Biopsies, where a small sample of tissue is taken for examination, are often used to diagnose cancers and other diseases. They provide a definitive diagnosis that can guide treatment decisions. It's also important to understand the limitations and risks associated with each test. For example, while X-rays are quick and useful, they expose patients to radiation, so their use should be justified. Similarly, while MRIs are incredibly detailed, they can be expensive and time-consuming, and not all patients can undergo them due to metal implants or claustrophobia. Patient care is at the heart of everything we do. Always consider the patient's comfort, preferences, and overall health when deciding on diagnostic tests. Reviewing a patient's medical history and current symptoms can provide valuable context that helps in selecting the most appropriate diagnostic tests. Collaboration with other healthcare professionals is also key. Discussing test results and treatment plans with doctors, radiologists, and lab technicians ensures a comprehensive approach to patient care. By mastering these diagnostic tests and understanding their applications, you'll be well prepared for the NCLEX-RN and, more importantly, for providing excellent patient care throughout your nursing career. So keep studying, stay curious, and remember that every test you learn about brings you one step closer to becoming a skilled and compassionate nurse. Good luck! All right, let's talk about how our amazing bodies adapt to changes. Our bodies are like finely tuned machines, constantly adjusting to maintain balance and function. This process is known as physiological adaptation, and it's a testament to the resilience and complexity of the human body. It's like when you pop a deep one. The surrounding skin might be a little stretched and irritated for a bit. Similarly, when one body system is affected, it can trigger a chain reaction throughout the body. Think of it like a domino effect. For instance, if you have a cut on your finger, your immune system kicks in to prevent infection, your blood clots to stop the bleeding, and your skin cells start to regenerate to heal the wound. This is a simple example, but it illustrates how interconnected our body systems are. For example, a heart condition can impact lung function, which can then affect kidney function, and so on. When the heart is unable to pump blood effectively, it can lead to fluid buildup in the lungs, causing difficulty in breathing. This, in turn, can reduce the oxygen supply to the kidneys, impairing their ability to filter waste from the blood. This interconnectedness means that a problem in one area can have far-reaching effects throughout the body. Understanding this interconnectedness is essential for nurses. It allows them to anticipate potential complications and provide comprehensive care. For example, if a patient is admitted with a heart condition, a nurse must be vigilant for signs of respiratory distress or kidney dysfunction. This holistic approach to patient care is what sets nursing apart as a profession. You'll need to know how different body systems respond to illness, injury, and stress. This knowledge is crucial for developing effective care plans and interventions. For instance, understanding how the body responds to stress can help nurses manage patients with chronic conditions more effectively. Stress can trigger the release of hormones like cortisol, which can affect blood sugar levels, immune function, and even wound healing. This includes understanding the pathophysiology of common conditions and how they manifest clinically. Pathophysiology is the study of how disease processes affect the function of the body. By understanding the underlying mechanisms of diseases, nurses can better predict how a condition will progress and what symptoms to expect. This knowledge is essential for making informed clinical decisions and providing high-quality care. Remember, the body is incredibly resilient, but it's our job as nurses to recognize when it's struggling and provide the support it needs to bounce back. This means being attentive to subtle changes in a patient's condition and intervening early to prevent complications. For example, a slight increase in heart rate or a drop in blood pressure can be early signs of a serious problem. By recognizing these signs and taking appropriate action, nurses can help patients recover more quickly and avoid further complications. Section 2. Fluid and electrolyte imbalances. Maintaining equilibrium. Just like a pimple needs the right balance of moisture to heal properly, our bodies need the perfect balance of fluids and electrolytes. Fluids and electrolytes are essential for maintaining the body's internal environment. They help regulate everything from muscle contractions to nerve function and even blood pressure. These imbalances can throw our systems out of whack, leading to serious complications. For example, an imbalance in potassium levels can cause muscle weakness, cramps, and even life-threatening heart arrhythmias. Similarly, an imbalance in sodium levels can lead to confusion, seizures, and coma. Understanding these imbalances and how to correct them is a critical skill for nurses. You'll need to understand the causes, symptoms, and treatments for various fluid and electrolyte imbalances. This includes knowing how to recognize the signs of dehydration, overhydration, and electrolyte disturbances. For example, dehydration can cause dry mouth, decreased urine output, and dizziness, while overhydration can lead to swelling, high blood pressure, and difficulty breathing. For example, dehydration can lead to electrolyte disturbances, affecting everything from heart rhythm to muscle function. When the body loses too much fluid, it can disrupt the balance of electrolytes like sodium, potassium, and calcium. This can cause a range of symptoms, from mild fatigue to severe muscle cramps and irregular heartbeats. By recognizing these symptoms and providing appropriate treatment, nurses can help restore balance and prevent complications. Think of it like maintaining a healthy skincare routine. You need to replenish fluids and electrolytes lost through sweat, urine, and other bodily functions. Just as you would apply moisturizer to keep your skin hydrated, you need to ensure that your body has enough fluids and electrolytes to function properly. This means drinking plenty of water, eating a balanced diet, and monitoring your fluid intake and output. Remember, monitoring fluid intake and output, assessing for signs of imbalances, and administering IV fluids and electrolytes are all part of a nurse's toolkit for maintaining a patient's delicate equilibrium. This involves regularly checking a patient's vital signs, reviewing lab results, and adjusting treatment plans as needed. By staying vigilant and proactive, nurses can help ensure that patients remain stable and recover more quickly. Section 3. Medical emergencies. Staying calm under pressure. Now, let's talk about those oh no moments. Medical emergencies. These are the situations that require quick thinking, decisive action, and a calm demeanor. Whether it's a sudden cardiac arrest, a severe allergic reaction, or a traumatic injury, medical emergencies can be incredibly stressful and challenging. It's like when you're about to extract a massive blackhead and things take an unexpected turn. You need to stay calm, think fast, and act decisively. In a medical emergency, every second counts, and your ability to remain composed can make all the difference. This means staying focused, following protocols, and working effectively as part of a team. You need to stay calm, think fast, and act decisively. This involves quickly assessing the situation, identifying the most urgent needs, and implementing appropriate interventions. For example, if a patient is experiencing a heart attack, you might need to administer CPR, provide oxygen, and prepare for defibrillation. Each step requires careful attention and precise execution. As a nurse, you'll need to be prepared for a wide range of emergencies, from heart attacks and strokes to respiratory distress and allergic reactions. This means having a solid understanding of emergency protocols, staying up to date with the latest guidelines, and practicing your skills regularly. By being well prepared, you can respond more effectively and provide the best possible care for your patients. Knowing the signs and symptoms of these emergencies is crucial, as is understanding the appropriate interventions for each situation. For example, recognizing the early signs of a stroke, such as sudden weakness or difficulty speaking, can help you initiate treatment quickly and improve the patient's chances of recovery. Similarly, knowing how to manage anaphylaxis, a severe allergic reaction, can be life-saving. Remember, time is of the essence in emergencies. Every second counts, and delays can have serious consequences. This means being able to prioritize tasks, delegate responsibilities, and communicate effectively with your team. By working together and staying focused, you can provide the best possible care for your patients. Your ability to remain calm, assess the situation quickly, and provide prompt and effective care can be the difference between life and death. This is why ongoing training and practice are so important. By continually honing your skills and staying prepared, you can ensure that you're ready to handle any emergency that comes your way. Remember, as a nurse, you are the front line of patient care, and your actions can make a profound impact on the lives of those you serve. And there you have it, a crash course on some key topics for the NCLEX-RN. We've covered a lot of ground, from the importance of patient-centered care to the complexities of physiological adaptation. These key topics and tips should help you focus your studies and increase your confidence in taking the NCLEX-RN exam. Remember, just like in dermatology, practice makes perfect. Good luck and happy studying.